I first saw TJ in 2016. When I came to him, I had been in chronic pain, back pain, for about 10 years. I had had an L4, L5 discectomy, and the chronic pain began shortly after that surgery. I had had 2 pregnancies in those 10 years. I had been to no less than 10 different physical therapists, 7 or 8 different pain management physicians. Shortly after the surgery, I was prescribed opioids for the pain, and I remained on them for those 10 years, minus the pregnancies. I had been prescribed hydrocodone, oxycodone, Butrans patch, and when I saw TJ, I was on a fentanyl patch and hydrocodone for breakthrough pain. Most of the PTs I saw would give me exercises to do, 10 reps of each exercise, and send me on my way. Each pain manager seemed to have a different idea of what was wrong with me, and so that led to about 7 or 8 different procedures: epidural steroid injections, facet joint injections, radiofrequency ablation from the facet joint and the SI joint. None of that really worked. By the time I saw TJ, I had deep hip pain and back pain that would go up my back and into my neck, spasm, muscular pain, and leg aches, pain that would go down my legs. I couldn't stand for more than about 10 minutes, and I was 36 years old with 2 young children. He quickly diagnosed unilateral pelvic dysfunction and began his manual therapy technique for treatment. I recall it taking about a month before things would move enough. And in that month, after that month, I was off the opioids for good. Following that was about 4 months of pretty rigorous, intense rehabilitation, strengthening exercises before I was completely pain-free. What TJ does and how he does it saved my life. He gave me back my life. And for that, I am forever grateful to him. He was able to diagnose and treat my pain in about 5 months, and no one else had been able to do that in the previous 10 years.